Okay, does the recording button show? I think
It
we're
does, yes, perfect.
okay, fantastic. So hello, audience from Women's Abundance and KH Essentials and any other women that are out there or men interested in the topic of women's vitality and women's health. I am so honored to have Dr. Shery Ross with us today. Um, she is the author of She-ology, and She-ology, the sequel, which just came out this year. And I am catching up on this book. But as you guys know, I have read many books, and this is by far my favorite. Her voice in here is fantastic. And I'm going to show you pictures and read a little bit. But for those of you who don't know who Dr. Shery Ross is, she is an incredible OBGYN. She has been a woman's advocate for more than 25 years. She has been on more TV shows than I can name, from Dr. Phil, I think, right, Dr.
Oz.
Phil and Rachel Ray, or
Dr. Oz, not Phil.
Dr. Oz, Rachel Ray, Inside Edition, Mom's Planning, Home and Family. She's also been recognized in many magazines. Besides this book being noted as, I think it was one of the top 5 or 6 nationwide books on wellness. She's also been voted top doctor. She's got many patient choice awards. She resides down in Southern California. So a warm, warm welcome to Dr. Ross, Dr. Shery, as we call her. So do you?
I'm thrilled to be here, Karen. Thrilled. Thank you for that kind introduction.
Oh my gosh, you guys, I cannot wait. So I'm going to start, Dr. Shery, with a little bit. I'm going to read a tiny bit from your book for the audience to let them know a little bit about who you are and what you believe in. So in her introduction to She-ology, which was released in 2017, Dr. Shery says, a healthy and confident vagina. Oh, by the way, everyone, look at this. This is what she stands for, and I love it. The Vagina Revolution. So back to the book. A healthy and confident vagina is a beautiful thing, the seat of our power, our sexuality, and our ability to create life. And a vagina that needs a little attention, medical, emotional, or a good old-fashioned common sense is nothing to inspire shame. It's a part of the cycle of our lives, how we grow and mature into the many stages of femininity. So why not embrace it? Love it, wax it, or actually choose not to, and let the big bushy really come out and back into style. But above all else, talk about it. Talk about it with your doctors, with your partners, and among yourselves. And as you guys know, this is one of my missions in life after my cancer surgery and moving into menopause, and not being ashamed about how women naturally go into menopause. And I love what Dr. Shery does with really connecting women with all of the phases of from PMS all the way through postmenopause. So today, our interview is going to focus a little bit more on, I think we'll start, Dr. Shery, with as a lot of women get older, there seems to be a trend towards vaginal dryness or vaginal atrophy. And, you know, when you and I spoke, we talked about there's a lot of immediate quick fixes like lubricants that can help with sex, or there's estrogen is a very common go-to. Topical estrogen can help. But one of the more uncommon things that I wanted to have you share with the audience today is around hyaluronic acid. But if you could talk about all three, kind of the short term, the long term, and the benefits of all, I would love to have you share your perspective and your brilliance with the audience.
Thank you. Well, it's such an important topic, the vagina in general. And you know, I always say my books are for anyone that has a vagina, loves a vagina, or wishes they had a vagina. So we pretty much, I'm so glad you like that shirt. The book was really the Vagina Revolution is on, because if you can't talk about it, then how can you take care of it? And I really believe that to the core. But in sexual wellness, and I think that is even more of a taboo topic than even saying the word vagina. And if you think about it, 65% of women have code names for the vagina. What's your code name, Karen? Before you learned to say vagina, what was your code name?
Oh, you know what? I did love how I forget who it was in your book, the JJ.
Yeah. From
Or
Tunnel of
down
Love.
there. I remember when I was a little girl, it was, oh, down there.
Yeah.
Right.
Yeah. So I think that, we are on a grassroots movement to talk about our vagina, and then really to talk about sexual wellness. And I have a soft spot in my heart for women over 40 as we sort of age hormonally, and what happens physically and mentally to the vagina and how it affects us sexually. And so, physically in our 40s, we're starting perimenopause and a lot's going on. We're noticing changes, and, we get the plethora of all the menopause symptoms, from hot flashes, night sweats, insomnia, depression, anxiety, but low sex drive, and then vaginal dryness, and then the 50s really bring it home. So I talk about this all the time because it's not just about that lube. It's not just that lube's going to fix everything. And that's really what we're told. But there's so many other things that we can talk about. And, estrogen vaginally is also helpful. Estrogen, it's you shut off the valve, the vagina gets dry, tissue gets thin, it's torn easily, you have burning, intercourse, sex is just not on the top priority list. So vaginal estrogen, yes, you're replacing what we are missing. But there's other really great things. My favorite thing is hyaluronic acid vaginally. They did this great study, Karen, in 2013, and they looked at hyaluronic acid gel, and they compared it to estrogen gel. And they looked at 70 women in each group, and what they found was that the benefits to the tissue, the hydration, moisturizing, all those good things that toughen up the vagina and make the vagina smile, is the same. So if for those women who are afraid of estrogen, or they don't want to go on estrogen vaginally, hyaluronic acid is the answer. And I'm a huge fan of it. I think every vagina over 40, every 3 days, should be using hyaluronic acid as a moisturizer, because it's so important to embrace and take care of your lady parts, vulva, vagina, as best you can and as early as you can.
I'm so happy that you brought that up, because I know when we first met, you talked about that. And I think a lot of women associate that with facial peels and like a burning. And so does it hurt? Does it sting? What are some of the more practical tips that I could imagine some of your patients ask you, or their comments?
It's such a great question too, because the vagina and the very delicate nature of the vagina and the vulva, is such that you have to be using very vagina specific, very vagina friendly products. And the one thing that I tell all my patients, because the tissue is so delicate, it's so fine, you have to take care of your vulva and your vagina just like your face. You have the same ritual. You hydrate, you moisturize, you use face friendly, or in this case, vulva and vagina friendly products. Because if you do that, the tissue stays very healthy, it stays vibrant, the tissue has its elasticity, and it's going to age so much more gracefully, and there'll be less dryness, and the skin quality will be so much better. And if we started this in our 20s, just think, I think we wouldn't have most of the problems that women are facing now in their 40s and older, as it relates to sort of low estrogen or no estrogen.
I'm so glad that you mentioned the 20s, because as you and I have spoken before, one of the, my goals with the women's health panels that I do, and even women's abundance, is how do we inspire the 20 and 30 somethings, when I remember when I was that age, super healthy, and I'm still very, very healthy, but I just wasn't thinking about the future, right? Because I was easily lubricated. I didn't need any lube, but my body was doing what it needed to do naturally. And I think you're right, especially when you say women spend so much time and energy on their face. and yet their
Exactly.
vagina is really the source of so much of what being a woman is about. So one last question, or maybe my last. You might inspire another question, but on this first topic of hyaluronic acid and the difference between the outer vagina and the inner
Yes.
walls, are there? I'm. This is a hypothetical question because I think I know the answer, but I want you to answer it. Like, how would you guide women on the difference between the moisturizers on the outside versus
Yeah.
the inside?
And 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 it's a good question because the tissue is very different. Um, I am a huge fan of extra virgin coconut oil. I have all my patients using it. And this is the way you use it because the vulva is equally as sensitive and delicate, and you need to use very specific ingredients, very non-fragrant things that won't disrupt the pH balance. So I like to tell women, take a handful of extra virgin coconut oil, throw it in your warm bath water, soak in it, 3 times, 4 times a week for 20 or 30 minutes. What that does to the skin on the vulva is it moisturizes, hydrates. We're going back to the ritual that we're talking about, that I am really trying to drive this message home, because the light bulb goes off that, if we're going to take care of our face in our 20s, which we do, you have to think about your lady parts, the vulva and vagina, in the same way. So outside, you soak in a bathtub, you allow the skin to be moisturized, because whether you're waxing, shaving, whether you're wearing pads all the time, which are, sort of the root of all evil to skin tissue, it dries the tissue out, and itching is very, very common. So it's a very natural way of moisturizing the outside of the vagina, the vulva, and then inside, the hyaluronic acid, again, made for the vagina, specific products that are, again, doing the same thing, moisturizing, hydrating the tissue. And it's, I say this all the time because I see vulva all the time. And in doing that, I'm, like even today, I saw a woman who's 16. She said, "Oh, menopause is no problem. No problem at all for me." I'm like, "That's so great." And I'm like, "What about vaginal dryness with sex?" And, "Oh yeah, that is a problem." And she just went into this whole, 20 minutes of how sex is painful and the outer, lips tear. And so you don't even think about it. Like, we need to think and prioritize our vagina, ladies. If anything, I don't care how old you are, you're never too young to take care of this area. And that's really a message. And, in fact, I've partnered, kind of hot off the press, with a skincare line, Urja Beauty, who make products that are clean beauty that just are natural and pure, and there's no additives. And we're going to make Urja intimates for the vagina and vulva with these same philosophies, so that women know you don't want to use the same bar of soap to clean your underarm and your feet and then the vulva. And by the way, are we supposed to clean the vulva anyway? I mean, isn't it self-cleaning? I mean, there's a lot of vagina confusion.
Right.
So we need to start clarifying. We need to take care of, embrace it, love it, clean it, but also prevent sort of some of the problems that now we are all seeing in our 50s.
That's fantastic. And I hadn't realized you're doing that. I love that, because I was going to tell you a product. As you know, I make natural skincare as well, but mostly focused on things that help that I did after cancer. Um, but I do have one lube that is obviously not a fixing, and then I've made a coconut based vitamin E pH balance balm that is for women for the external, and it's been gifts for many of
Nice.
my friends. But yeah, I
That's
agree.
great.
I agree, and it's just I love that you're going to do that. So we'll have a conversation another day about that, because I'd love to hear more. But let's move into, so if we get away from the outside, so you're taking the bath and that's the outside, on your Urja products that you're going to be developing in the future, are you doing any for the inside that are inserts? Like, some tips from other OBs that I love this tip is to take, again, extra virgin coconut oil, and make a little ice cube ball out of it and
I do
insert
that too.
that.
Yeah.
And then the coconut oil melts inside the woman's.
Yes. I love that. And I actually make that recommendation too. Extra virgin coconut is such a great base for things. It's just a great moisturizer, and it's a natural product, and it's not expensive. It's just, I just think that's a really good foundation for so many things that are vagina friendly.
Mhm.
And it's actually also antifungal. So it's kind of nice in that way too.
Right, right. Okay, well, more to come on the Urja products, the intimate line. Okay, so let's move from vaginal atrophy and what women can do at any age there into something that made NAMS. And for those of you who've heard me talk about NAMS, it's the North American Menopause Society. And of course, Dr. Ross, Dr. Sherry has probably been there many times. But this year, they actually started talking about the mental state of mind for women and how important and what a big impact that is in her sexual vibrancy. And so if we move away from the physical and move into the more mental states, I wanted you to share with us everything that you, well, maybe your top three things on what you think about the mental state and how that's changing and what research is changing. And I know there's supplements, but there's also just different things that you probably tell some of your patients to enhance their sexual experiences and their intimacy.
Yeah. You know, I love Cheryl Kingsford, who's NAM's president. I think she's forward thinking, and she just is out there on a mission also to really talk about, the issue with women. I mean, our sexual desire, it's all above the shoulders, right? It's the brain is our number one erogenous zone. And because it's about desire, if you think about hyposexual dysfunction, low sex drive, right? 40 million women have low sex drive. And there's so many reasons. I mean, look at your 40s. You're either, you're putting your kid in college or maybe rehab. You're deciding if you actually like your partner. You're working hard financially. It's a very stressful time for women. And usually when our head hits the pillow, we're not really thinking about sex, because sex for women, it takes a little bit of thought and focus. Usually your eyes close and you're not really thinking about, am I going to have a great orgasm here? You're like, oh my God, did I sign my kids, slip to go on that field trip, or did I pick up this at the market? So it takes work. It takes work for most of us to have orgasms, especially as we get older, especially as estrogen declines, because we know the clitoris and all the erectile tissue there is affected by low estrogen. So not only mentally are we struggling and have to really focus on our desire, but we're also have to physically, we're a little bit behind as well. So we have two things that are happening. And so really the issue, when you look at all the FDA products for men, and there's like 26, and I think, we have one or two that are sort of mediocre and not that practical. It's really focusing on desire. And that's such an important element to our sex drive, to making sex successful. And success may not mean orgasm, but just wanting to enjoy your partner or enjoying yourself. I'm all for masturbation and really, exploring your body too. But, it's about focusing on desire, and that's where our issue, and maybe the lack of choices, the blue pill doesn't work for desire. So we are looking at some of the herbs that have been well studied, and what can we do to help women with their desire.
And when you and I spoke, you talked a little bit about L-arginine, right? Do you want to speak a little bit about that?
Yeah. So L-arginine is an amino acid. It's actually been studied sort of with a group of herbs: L-arginine, L-citrulline, rosehip, and pine bark. And this is sort of the fabulous four when they look at improvement of sexual function, as it relates to improving sex drive and our sexual arousal, which is, important because it's a chemical that helps with blood flow to the clitoris itself, but all these other combination also improves our mental desire. So these are sort of the 4 golden herbs that actually have a great study behind it, to help women's sex drive. And it's something that I'm really excited to, explore with women, and a product that we've created we haven't quite launched, but it's based on these products because they've been studied to show a benefit.
Hopefully you can't hear that noise, but this is COVID and my neighbor's doing something. Can you name the 4 one more time just for the audience? So L-arginine, rose hip.
So it's L-arginine, L-citrulline, rose hip extract, and pine bark extract, pycnogenol. These are sort of the 4 that have been used in combination to improve sexual function. And they found, actually, after 1 month using it, that 60% of women found a benefit, and sort of after 2 months, it went up to almost 75%. So they really found that, these effects of dilating blood vessels and increasing blood flow to the vagina and clitoris area, and then helping mental component had all these benefits for women. And it's exciting because it doesn't, there's just kind of a safe alternative for women, and there's really no downside to it.
I love that. And I love how alternative you are in your thinking as well. You're one of the doctors out there, the Western OBs, that actually also looks at natural supplements. And I think a lot of the viewers are very interested in that. Are these particular compounds in your She-ology supplements that you offer online now?
Well, so our focus on Desire product, which is made of these 4 ingredients, we're really meant, improving arousal, improving orgasmic response, and sexual satisfaction. These are sort of the 4 components. I also added fenugreek to it, and ashwagandha for, other additives for sexual desire and experience. And ashwagandha is so good for anxiety, and right, and it just also has an anti-inflammatory effect and stress. So it was sort of adding those 4 plus. And it's not part of our launch products, but it's first to come out, and then we do have a focus on Desire for her, and then one for him, because men also have issues related to desire, believe it or not.
Well, they're human too, right?
So. Exactly. I mean, it's so true. We just think, blood flow to the penis, erection, but there's just so much more to it, that we also know that they have menopause, right? They're losing their testosterone similarly to us, but they have, 26 options for, improving their erectile dysfunction.
Okay, I am going to move. I'm going to move the interview on to something that I don't think a lot of people know, which I was, for me, it was new when I learned from you too. And I did just get this in the mail from you. So you guys, for a lot of women, and as you know from the intro that I read to you in Dr. Sherry's She-ology book, it's important to talk about things. And a lot of women are very shy about talking about things that actually, like sexual pain, or there's just embarrassment that she and a lot of other women like myself are trying to help women not be so shameful. But one of the things that Dr. Sherry has invented is vaginal dilators that are wearable. And so I wanted her to talk to you guys about why they were invented, what kind of customers, or what spawned the invention of them, and how do women use them, and why do they use them? And then also, everyone, I didn't mention in the beginning, I met Dr. Sherry through Stephanie from the Pelvic Health Rehabilitation Center. She was introduced, and as you guys know, as you women know, Stephanie was a speaker at the second Women's Health panel. Which obviously is very interested in helping women with dealing with any sort of vaginal atrophy or vaginal pain, or anything around that. So can you talk about the history of the wearable devices?
Yeah,
great.
So sexual health is another really important topic to me, and I see at least 50% of women are having painful intercourse. And when I would really sit down and talk to my patients, and they'd be like, well, I sort of asked that question, well, how often are you having vaginal penetration? You know, if it's just birthday and anniversary sex, that's not so good for the opening of the vagina, because ultimately it's not just about give me some more lube. It's beyond that. It's about what happens to the entrance. And so I sort of coined this collapsed V. I have a chapter in it in my second book. It's really for women who have problems with penetration, you know, and it may not be a penetration with a penis. It could be a dildo or something like that, or even for my trans patients, my trans women, it can really be used for painful intercourse. If you haven't had sex in 6 months and the opening starts to collapse, if you have vulvodynia, vaginismus, or breastfeeding and now you need to have sex again after not having sex for 4 months. There's a lot of reasons why you might want to have something put into the opening of the vagina and wear it. So dilators have always been that. But what we had medically were just like these plastic dilators. The tip looked like the head of a penis, and they were really expensive. And that was sort of what I knew about dilators. I met this woman, Sean Colvin, Susan Colvin. I like Sean Colvin. She's a musician.
She's a great musician, yeah.
Susan Colvin. Long story short, I'm on the board of Planned Parenthood. Her husband and I were friends. He's my board buddy. He said, you have to meet my wife. And I went to her distribution center. She does sex toys, probably the biggest in the world. But she had this whole area in her, her demo room that was on wellness for breast cancer patients, because she's a breast cancer survivor, and things for mastectomies and Kegel instruments, and then these dilators, and they were just beautiful, and they were silicone, and they were just soft and gentle, and so I brought them back to my patients, and I was using them on all these patients we've talked about. And one patient said to me, she's like, Dr. Shery, when I have to lie down with these dilators for 30 minutes, 3 times a week, if I'm laying down, I'm either sleeping or dead. She was like, and it dawned on me that why can't we make them wearable? If we had them wearable, we'd have much better compliance, and it would just be so much easier. You could be sitting up, you could be cooking dinner, you could be working out, because they're basically the same thing. So I partnered with her. We put on a sort of a base that allows you to insert them into the vaginal opening and wear them. And I just had great response. The physical therapists that do pelvic floor dysfunction, Stephanie being one, I mean, doctors like myself, we just have to partner with them, because they are doing so much more than the gynecologist can ever do to really improve sexual penetration. And I've had really happy patients who've come back and have been able to enjoy vaginal penetration with their partner again.
Thank you so much, and thank you for sharing the devices with me so I could help other women understand what they are, just to show people one more time, especially after talking about that. So you recommend like inserting and then wearing and working up to wearing them for a certain amount of time.
Yeah. So the little one, start with the small one, is, I mean, if I have a vaginismus patient who can put that in her vagina herself, I mean, she is just, has found the complete treasure at the end of the rainbow, because it's terrifying, and they're just gentle, and they're so easy to use, and they're not expensive. And I think this is a conversation, again, doctors are not having with their patients. And I think we talked about the average time a doctor spends with the patient is 7.5 minutes. What can you really talk about, especially as it relates to sexual problems, which are hard enough to really tap into? So I'm really excited about this conversation. I love that you're doing it. I think all breast cancer patients should at the same time be counseled about sexual wellness, talk about dilators, talk about things that hyaluronic acid, just from the get-go. And I think in my first book, you'll see the Pink V chapter, which talks about issues as it relates to sexual dysfunction, to our cancer thrivers with breast or ovarian or cervical. I mean, it is, it doesn't mean it's the end of your sex life, but it feels that way often.
Yeah, I mean, yeah, it's definitely a challenge for people who are put on estrogen inhibitors or forced into early menopause. I think it's a shocker for that part of the population. But like you said, there's just the regular old transition in life that's going to take us through some of this natural atrophy. And I also, I support you in that shout out to pelvic health care because um, I think that in our country, we do a disservice to women. They should be sent directly to pelvic health rehab right after they have a vaginal birth. And just that should be part of the normal insurance care. And insurance agencies oftentimes don't cover much for pelvic health right now. So I think I'm going to continue to try and be an advocate for that as well,
Mm-hmm.
just because I think it's really important. And in Europe, it's a little bit more common, you know?
Right. That's true. I think they do talk about it more. I think more of a socialized medicine structure also encourages sort of more of these services that, doctors aren't really spending the time that they should with their patients to help them on just things that are so important, so
Right,
very important.
right. So, Dr. Sherry, before we end, I want to show the readers this incredible artwork that is throughout all of her books. So, for example, this is the mama vagina. As you can see, a baby nursing and very tired. And then if we go to that collapsed that she was talking about for the dilators, here's the collapsed vagina, and every chapter is brilliantly named and brilliantly illustrated with different versions of a vagina. The here's a baby maker vagina, and then there's another one for the menopause one, the mature V, which shows a woman in front of a fan, and here is the bashful V, right, which we're trying to break down. But it's just a brilliant, brilliant book. So for those of you who have not bought this, um, either of them, great, great books, best time sellers. And I mean, you're a reason for me to move to LA. That's how good you are.
Oh, thank you.
I'm
Thank you.
impressed.
We should
And I
talk,
wanted,
talk more vagina, Karen, anytime.
yeah, yes, and supporting the revolution. I did want to end on a really positive note to talk about, are you still moving forward with doing a talk show with Sarah Hyland? And do you want to talk
Yeah,
about that? And I think maybe Ellen's digital network, but I think it was going
yeah.
to kick off in August, but I know I wasn't sure if that's still planned.
Yeah, yeah, no. So doing a show with Sarah Hyland called Lady Parts, and it's on Ellen's digital network. And again, it was women want to talk about the vagina and issues related to vaginal health, which I love. It was hard to sort of do it on mainstream airways because saying vagina is like saying the F word, right? So the digital space was such a great idea. We have 9 episodes, kind of ready to go. I think with COVID and, sort of the social media with Black Lives Matter and, there's just more prioritizing of the whole entertainment world. So they're restructuring and just everything's trying to get put together, but we're really, really excited about it. So I'll let you know when it airs. And very excited to just continue the conversation because it has to be this grassroots movement of women like you, Karen, and your audience to just keep going, keep talking, and continue to make changes with the V.
Great. Well, thank you. Thank you so much again. It was such an honor and a pleasure. Do you want to have any parting words to women?
My favorite parting words is women have to be their best healthcare advocate. You really do. If you're not happy with your current healthcare provider, find one that you feel is listening to you, really hearing what's happening, because your sexual wellness, your vitality, your vibrance, your vagina, you have to enjoy it and love it. And menopause is just the second half. So I just think women get better with age, and so should the vagina.
I love that. I love that. Well, thank you again for taking your time. I sincerely appreciate it. It was such an honor and a pleasure, and I look forward to talking with you soon.
Anytime, Karen. Thanks for having me. Thanks for listening.
Okay, take care.
Bye.